my alarm bells came really suddenly,
Uh-huh.
completely out of the blue. It was the classic. I bent over to do something. I thought, just get them to bed. Bath time, just get them to bed. And the toddler rolled off my bed onto the floor and broke his leg. Got this underlying belief that my spine is fragile and I shouldn't move it too much and I shouldn't impact it too much.
Yeah.
And she said to me, just go out for a run. I was like, but I can't. My spine. She was like, no, just try it. I was just going to say, when a physio said to me something similar, but the way he worded it was, I think the pain is in your head. And I kind of wanted to punch him.
I just wanted to start this episode with a message of thanks. Thank you to everyone that chooses to listen to this podcast. By doing this, you're enabling me to reach more people so that they might learn how to unchain the pain to live a healthier, happier life. The feedback that I get from those that take action and are inspired by the show's content is incredibly rewarding. So I'd like to ask you a teeny tiny favour. You are truly able to change the course of this podcast, the types of guests I have on this show, and everything that I do by doing one simple thing. And that is simply hitting the subscribing button. The guests on this podcast are incredible because so many of you have hit that button. When I think of what I want to do this year on this show, this is fueled by the amount of you that subscribe, that tune in, and that comment on the show's content. So please keep subscribing, keep commenting. Any type of comment, please keep them coming, and keep sharing the shows that you find inspiring. I can't wait to see what this year brings for this show, for you, for my community, and for this platform. Thank you.
Welcome to the show, Brain Health, Unchaining Your Pain. I am really looking forward to this conversation with the wonderful Katie Rothwell. Welcome to the show, Katie.
Thank you so much for having me.
You're most welcome. I know we connected through a pain webinar, which was through the UK coaching organisation whose name's completely surpassed me. And I'm very sorry about those that are listening from the organisation. But you're a pain therapist, and I'm really excited to learn about your journey that led you into becoming a pain therapist from a personal story perspective. But before we dive into that, I'd love to know what you are passionate about in life right now.
I know it's cliched, but it's very relevant to what I'm doing because I've sort of come up with this beat pain idea as a result of my own journey. So what I'm passionate about is there's so many people out there fighting chronic pain, and I just want to be able to reduce their journey, reduce the time frame that they're in pain for, because there's people in pain for years and years and years trying everything. And I've been there, and I've spoken to so many other people that are there. And it's from this sort of understanding that the doctors are going to fix me, or my pain is physical. It's nothing other than physical pain. My pain is so real. It can't be anything but physical. And it's trying to get people to understand the bigger picture of pain so that they kind of have those aha moments and, as you say, unchain their pain and start living their life again. So it is generally what I'm doing is what I'm passionate about, and getting people enjoying life and resonating with what they enjoy doing, getting outdoors, getting active, doing the sports that maybe they once loved doing, because that was me as well. And I am like literally living and breathing it. And I guess in my spare time, I'm being active and getting outdoors and enjoying life. So yeah, my job is my passion, which is probably a good thing.
Yeah, I love that. And I really resonate with the pain journey, because I have what's deemed as a frozen shoulder, which started doing a military fitness exercise fitness test actually, and I really pulled it and jarred it because of the new fitness assessment, and it's been a journey for me and I'm finally coming out the other side. And like you say, it's not just the physical pain that we typically associate with pain. There's so much more to pain than that. So I'm super excited to hear about your journey. As we dive into your journey, I'm curious to know, given what you know from pain, what does optimal brain health mean for you personally in the context of your journey?
I saw that you'd written that, and it's such a great question, because I've been thinking about how to answer that, because I think we have been so disconnected from brain and body, and optimum brain health is actually the controller of everything else that's going on in our body. And there's so many things that can go wrong, but is connected to the brain. You know, for example, if the brain is perceiving danger, if the brain is in sort of fight flight mode all the time because we're stressed, because we're busy reading emails, running around after the kids and cooking and washing, and you don't give any time for yourself, we're not at that optimal brain health. And then something yells at you, your body is trying to tell you something. You know, Gabor Mate says the body says no. At some point it screams at you. So I think optimal brain health, there's so many inputs into that, whether it's nutrition, whether it's sleep, whether it's movement, whether it's calming our nervous system and mindfulness and meditation. All of this contributes to optimal brain health. And our ailments, whatever that may be, whether it's pain, inflammation, acne, obesity, diabetes, heart disease, all of this can be a kind of alarm bell telling us that we're not at that optimal health. And I think if I know that I'm in optimal health, I know that I'm able to be sort of not in control of my emotions. I don't want to be shutting down my emotions. I want to be aware of them. But I'm also very much like my nervous system is in a controlled manner. It's not going to overreact to certain stimuli, because I know I'm at that kind of equilibrium. And it's not sort of oversensitized, and I can go about my daily life without the sort of burden of brain fog or whatever it might be. So it's not a straightforward answer, is it?
No, it's a great answer, because I love the fact that you talked about two things there that are so important that we often forget about. And the first one is our awareness of what is off kilter, or not, or off, as it were. We're not optimal, and often we don't tune in to being aware of something being off, and there could be a whole host of signals. And then you mentioned the alarm bells aspect, and so often we turn down the alarm bells, or we don't listen to them. We don't listen to the warning signs that something is about to happen, and that's when we can become oversensitized, because we haven't tuned in and heightened our awareness in the first place as to something is going in the wrong direction, and we're not at that equilibrium that you mentioned. So I think it's so important. I think awareness is one of the foundations of being able to return back to optimal health, whether that's optimal brain health or optimal whole body health. And our brain runs everything. So I think it's so important. When did you start having alarm bells? When did your alarm bells start ringing in the context of your journey?
My alarm bells came really suddenly, completely out of the blue. It was the classic. I bent over to do something. I had a toddler, a 1-year-old at the time. Maybe I was bending over to pick him up. I can't quite remember. And I had this excruciating back pain. I couldn't come back upright. I was sort of stooped over. I couldn't straighten. I couldn't breathe properly. And I was home alone because my husband was serving abroad with the RAF, and I had to get my toddler to nursery so that I could get to work. I was in the military at the time.
Yeah.
And I remember saying to him, can you walk to the car? I mean, he was only 1, he was barely walking. I was like, can you just walk to the car? And I was sort of stooped over the car trying to do up his car seat one-handed. And I don't know how I drove, but I did. And I got him to nursery. I got the nursery workers to come and get him out. So at least I'd sort of offloaded him, and then I managed to get myself to the med centre at the RAF base where I was working, and sort of hobbled my way in. And I think initially I was given painkillers and anti-inflammatories and all this, and then I was put on a referral for an MRI scan. And then with the RAF, the medical system's actually really good. They sent me on a month-long spinal rehab course, which was like, you know, all day. I was taken off my primary role, and my only focus was my spinal rehab, which was a great course. And it was pain education, it was physio, it was hydrotherapy in the swimming pool, it was circuit sessions, it was relaxation, and it helped, but it didn't fix me. And massage therapy helped me, cranial sacral therapy helped me, but all this help was sort of short term,
temporary.
I wasn't getting that long term benefit. So yeah, it hit me like a truck, basically. It didn't come along gradually at all. Took me by complete surprise.
I can really relate to your story, because I remember I went on a cycle ride with my family just away for the weekend, and everything was fine. And then when we were driving back home, I went to get out of the camper van, and I literally could not get out of the camper van. Like, my whole hip had seized up, and I couldn't, you know, it just came out of the blue, and it was I literally had to lift my leg to get out, and it was just completely random. It just suddenly happened. And
it's so strange, isn't it, how we get these pains?
Yeah,
you know, the amount of times I get clients that say, all I did was tie my shoelace, or all I did was bend over to pick something up. Why was it then? But it's like the straw that broke the camel's back, isn't it?
Yeah.
You know, it's everything that's been going on before that.
Yeah.
That, you know, there's a breaking point. It's like filling up a pressure cooker.
Yes.
And then there's just one final thing that just goes.
Yeah. And it might be absolutely unrelated, which is what I'm curious to explore from your journey. So you went on your journey with the rehabilitation through the traditional routes, and it was temporary. What happened next then? How long was that journey that you went on before you're like, oh God, this is not working?
Well, it was just that I was still just trying everything. I think I tried acupuncture, I tried McTimoney, I tried Bowen. But the thing that gave me the most relief, that was lasting the longest period of time, was massage and cranial sacral therapy from this massage therapist. And then I tried an osteopath, and he sent me away and said, just look up this YouTube video from Lorimer Moseley, Lorimer Moseley's TED Talk. So got home and I Googled that. And you're probably aware of Lorimer Moseley's work, the pain scientist in Australia, and he's got his own pain story. And he talks about it on this TED Talk in a really kind of funny way, but a really informative way, even for a layman to understand, about how pain is not related to physical damage and vice versa. And that you can have excruciating pain and there be no physical damage, and you can have the tiniest bit of damage, like a paper cut, and a lot of pain. So it's not comparable. And when he explains it, it's about how the pain is processed in the brain, depending on all these other factors that are going on. And if your nervous system is already wired in fight flight mode, you're stressed, you're not sleeping. Yeah. And as I said, it was quite key that my son he was only 1 year old. I'm single parenting, solo parenting, no parents nearby because I'm in the military, and my husband's serving in Afghanistan. And at some point during that journey, I can't even remember if it was before or after my pain episode, but he'd had a helicopter crash. Called me from the helicopter. He goes, don't worry, I'm in the green zone in Afghanistan, but we've just crashed, but don't worry. And so there must have been sort of lots of underlying worries. I wasn't sleeping because I got a toddler. And then when my second child arrived, everything was even more sort of amplified, because I wasn't sleeping the day, wasn't sleeping at night. And we were having all these other stresses going on. So I was, through pain education, which was sparked by Lorimer Moseley. I went down other avenues and just became really, really curious. I was able then to kind of associate flare-ups with, okay, so what's going on in my life? Okay, I've got that stress factor or that stress factor. And one of those was when he left the military, and I ended up leaving the military as well, not because of my pain, but I was offered redundancy and I was a parent and I didn't really want both of us abroad when we've got 2 young kids.
Yeah.
So anyway, we both left and my husband took an assignment to work in Saudi Arabia. And he took this when my youngest was only 1 month old. So newborn and a toddler. And I was meant to go and join him 3 months later, once they'd sorted out my visa. And they kept saying, yep, next month we'll get a visa. Next month we'll get a visa. And this went on for 2 years.
Oh my goodness. That's a lot of stress stacked.
It was so stressful. I was solo parenting for 2 years, not sleeping.
And how old? What was the age difference between your 1 month and your?
About 18 months.
Oh wow. Okay, so really close, and you know all of the challenges of raising little ones.
Yeah. Toddler and newborn. And the first week he was away, they phoned him up on Christmas Eve to say, we need you now. And he's like, oh, well, hang on. We're in Ireland on our Christmas holidays. No, we need you now. Fly out to Saudi Arabia now. We're like, well, the airports are shut. It's Ireland. So they said, no, don't worry. We're going to get you a private jet. And it's like, no, the airports are shut. So anyway, they flew him out on Boxing Day. So I then flew back to the UK with both little ones. The toddler vomited all over me in the airplane. I got home, there was the Tesco's delivery had arrived and both kids are screaming and I didn't have time to unpack that. And I thought, just get them to bed, bath time, just get them to bed. And the toddler rolled off my bed onto the floor and broke his leg. So day one of him being in Saudi and me at home, I was dealing with a toddler with a broken leg and a baby, so I had to carry them everywhere, both of them.
Oh my goodness.
Which didn't do my back much good, probably because of the stress, but not necessarily the weight, because I now know that it's not necessarily the physical damage. It was just all the stress. And I think, then my mum and dad came down to help me, and I realized that was at the end of that weekend, and I hadn't actually fed myself all weekend properly. Mum cooked a really good homemade meal and I just inhaled it. I was like, oh, I haven't actually fed myself. So yes, the whole Saudi thing was a big stress factor, which was just really ongoing. When we got out there, eventually after 2 years, he was actually in Jeddah and I was in Riyadh. I knew no one, couldn't drive. You have to cover up everywhere you go. I've got to try and get my eldest into school, and he was nervous weeing everywhere because of his anxiety, whatever. Because of stress, I had to get the little one some kind of childcare to give me a bit of respite. And it was just, I had to do it all on my own in Riyadh, knowing nobody. And that lasted another 4 months. And I was like, what's the point of me being here? I'm not even with you. Yeah. And then things calmed down and we had a really good episode, camping at the weekend, swimming after school and all this. And my neck, at one point in that, my neck flared up and I was having MRIs for my neck. And again, I think it was a physio in Saudi said to me, I get the feeling that being active is really important to you. I said, yeah, it is. I used to be physical education officer in the RAF. Of course it's important, but I'd been told by a consultant, because he diagnosed me with degenerative disc disease, I probably missed that bit in my story, that I shouldn't do any running, I shouldn't do any assault courses, I shouldn't do any hiking, nothing that would impact my spine. So I've got this underlying belief that my spine is fragile and I shouldn't move it too much and I shouldn't impact it too much. Yeah. And she said to me, just go out for a run. I was like, but I can't. My spine. She was like, no, just try it. So I did, and I felt better. And I was like, oh, okay, this exercise thing is actually benefiting me. So I started to sort of unravel bits and pieces of understanding pain in Saudi. But then things ramped up again on the stress front because we got evicted from our house in Saudi because my husband's company wasn't paying the rent. We got moved into a hotel room. I had the children crying, saying, "When are we going home?" And I was like, "This is home." This was at the point as well where Yemen were actually targeting Riyadh with missiles. And I remember hearing a missile land not all that far away from us. I said, "What's that?" My husband goes, "Oh, I think they're moving furniture upstairs." I said, "No, it wasn't." And then I thought, well, if we've been evicted there, how long are we going to stay in this hotel room? They'd already stopped paying school fees. And it's just, I don't know, Saudi, they just, I don't know, it seems that it's optional that they pay you or not. So I then came back to the UK because that was stability.
Yeah.
We had a house here and I could get the kids into school. I thought, my husband can go and sleep on a friend's couch, but all four of us can't. So I made that decision, and then he went back to Saudi. We were in a court case by this point with his employers, and they took away his exit visa. So he was now stuck in Saudi and I was here. But again, having the awareness of how that stress, I can't control the stress. I can't control what Saudi are doing to us. But what I can control is how I react to that stress. And at this point, you know, it's a good probably 6 years of me having the pain that I was able to unpick it and then feel more in control of it. So it wasn't that I wasn't having any pain. I just felt, okay, this is what I need to do. I need to just calm down or take some me time or go and do a bit of exercise or whatever it might be. So in that whole journey, I think I've just learned just so much about pain. And then I tried a bit of diet. That helped. And so, yeah, I've just put all that together.
And I think we underestimate the impact, you know, as I'm a parent as well. And you know, the journey that you just described is almost everybody's worst nightmare as a parent, going through, you know, having a supportive husband to now being a single parent, you know, looking after 2 young kids, to all of the move uncertainties. Then you've got war being layered on top of it, and it's just a huge stress bucket, isn't it? That when you look at each individual element, you think, okay, that's not so bad. But when you stack it all up, your stress bucket or your pot,
the pressure cooker,
cooker bursts because it can't contain any more stress anymore. And I think we often underestimate or discard the relationship between stress and pain because they're intrinsically linked
massively.
And I think you know, certainly on many physiotherapy interventions I've had historically, a lot of the physios I've spoken to say I think there's more to the pain than the physical pain that you're expressing, because it's actually quite low. I think you've got a lot of what they often deem as psychological pain intertwined with the physical pain, and you need to find a way to unchain it.
Yeah, so but do you know when?
Go on.
I was just going to say, when a physio said to me something similar, but the way he worded it was, I think the pain is in your head. And I kind of wanted to punch him. I was like, this is not in my head. I'm not making this up. But when you talk about psychological pain, there's a stigma still, and it's getting better, but that, you know, around mental illness, because I think mental illness, there's a difference, but there is a grey area, because there is definitely a psychological component. And I talk about the biopsychosocial model with the client. So there is that psychological component, but it's not all psychological. And when I was explaining to, in fact, it was my dad recently, that I've got this understanding of my pain, and I was talking about the emotional element. I'll come on to that in a minute. That I think my pain was possibly triggered by stress and emotion. And he turned around and said, "So what you're telling me, Katie, if you've got a mental illness?" It's like, well, in a way, but I think that generation has just got this real stigma associated with mental illness. And we are kind of unpacking that a little bit more now, because it's so much more than just a mental illness, isn't it?
Well, I don't even think it's a mental illness, right? Having a mental health challenge is a result of your brain being in trouble for whatever reason. And we all go through lots of struggles with our brain health. It could be that we keep forgetting things. It could be our stress tank is full and our pressure pot's about to burst. There's all sorts of factors, often external, environmental, that actually put us in a fight or flight state that we respond in a way that allows us to survive. Because if we didn't, we'd crumble and we'd have a nervous breakdown, and the show would be over. So if we're still surviving and living, we might not be thriving. Our brain has chosen the right route because we're alive. And it doesn't mean it's the right route over the long term, but it was the right choice at the time that the stressor or the trauma or the multiple traumas occurred, because we survived. And that's our brain encodes, I survived, so therefore that was the right response. And that's how it defaults. And I think we downplay the fact our brain is incredibly clever at keeping us alive. And whatever the chosen response is, yes, your outflow was pain, but actually your body was trying to keep you going. And because it was stimulated at a really heightened level, you had all of your receptors, and I'm not going to call them pain receptors, all your receptors firing. So everything probably, and I'm not saying it did, but got more amplified than it would have otherwise been if your parasympathetic nervous system, which is your calming state, was engaged. Your sympathetic nervous system, which is your fight or flight response, was constantly on, and it gets tired. It starts wearing out when we're in that place. So I think we need to give ourselves credence that whatever our chosen response at the time was, and we're still here, was the right response.
Absolutely. I listened to one of your podcasts with a chap that was sexually abused by his father.
Yeah.
And you talked about
Ryan
that.
Harland.
Yeah. And that was a really fascinating interview, because, you can beat yourself up about how you've coped with something. But as you said, we're alive, and your brain has learned. And there's a lot of sort of crossover between the adverse childhood experiences and chronic pain or chronic illness, because during that childhood, our nervous system is doing so much development and learning.
Yeah.
And if you are in that environment where you've got, say, abusive parents, or you're told just to shut up and kids should be seen, not heard, even if it's as minor as that, your nervous system learns that that's your coping mechanism. Right. So you might have to sort of be shutting down emotions and feelings, etc., and that's what you've learned to get you through. And then it still kind of goes back to that when we get into sort of trouble or problems. So even if you're in your 70s, your nervous system can still revert back to that coping strategy from a young age.
And if you absolutely, and if you don't understand the record that's been playing for 70 years, and that you can take the needle off the record and play a new one, because nobody's taught you how to move the needle off that record and replace it and put a new record on. You're going to be playing that in the background, whether you are aware of it or not. Going back to your awareness point at the beginning, is if we're not aware that these things are going on in the subconscious element of our mind, which many of us aren't, because we're not taught how to bring it into our awareness, then we struggle to understand and unravel the pain that we might be in, whether that's emotional, physical, mental, or spiritual, and what the dance is between those different elements of pain, because it's like a dance.
Yeah.
So I'd love to dive into you talked about the biopsychosocial model that you use, and how you have used that to help you unchain your pain. What were the key things on your journey that you discovered that really helped you have those aha moments that you know, oh, there's more to this than.
Yeah. So I think with the medical system as it is, we're sort of led to believe that everything has a biological cause. And so you go for your blood tests, your scans, your MRI, understand what that biological cause is. And we're trying to, hypothesize that's the reason for your pain. And that's the reason I got the diagnosis of degenerative disc disease. But when we go into chronic pain, very often that biological circle is a lot smaller.
Yeah.
It's not actually the major cause of our pain. Once you've ruled out all the nasty things that could be causing your pain, then actually you've got to almost ignore that biological cause and look at the psychological and the sociological, social side of things. So the psychological bit is, like we've just said, about the nervous system being oversensitized, wired in this, fight flight mode all the time. But it's also the emotional side of things, your emotional history, and how are we, that introspectiveness, how are we tuning into what we're feeling and feeling those feelings and not shutting them down. I had a cranial sacral session done on me, and in one of my own training sessions, and I had this huge emotional release, my whole body just shaking.
Yeah.
And what came out was that I had this anger and resentment towards my husband being in Afghanistan. I was like, hang on, I'm not allowed to feel that because he's in Afghanistan fighting for the country.
Yeah.
And I should be proud of that. But deep down, I was like, this is pants. He's out there doing what I've trained to do. I want to be out and serving abroad and getting the medals, but I'm here wiping nappies, and that's not fair.
Yeah.
So that's deep down what I'm feeling. But society tells me that I'm not allowed to feel that. So that is almost then the link to the social side is what does society say that we should be feeling? Like this, kids should be seen and not heard, and don't stop crying, or you're such a baby, or boys don't cry. That's all sort of society side of things. And also the culture that we're in with the food, the sugar, the alcohol, the ultra processed foods that's constantly there on tap, the convenience foods, that's all society. Our relationships, are they nurturing? Are they supportive? Are they adding to our own values, or are we just in a relationship because we feel we should be in that relationship? Are we in a warm, nurturing home, etc.? So that's all like the society side of things, and all of these start to paint part of your picture on pain.
Yeah, I agree. And I think the other thing that I think is really important is the spiritual element. So when we have a passion or a goal that we can't fulfill because it's been taken away from us, so we might be spiritually connected to a vision of ourselves in serving in society, or a vision of who we are and our internal compass that tells us how we want to show up, or who we want to be, or how we want to connect with maybe our higher power, or the vision we had for ourselves, our family, and the environment that we want to create. When that gets stripped away from us, when our jobs get stripped away, that whole spiritual element of ourselves that defines who we are can have a huge impact on our pain.
Yeah, that's so true, actually. Like when my pain came on, I didn't visualize me being a solo parent. We went into it together. I used to joke about my husband's a panda. He eats, shoots, and leaves. It's a bit of a military wife joke.
Yeah, but I mean, as a military wife, you might have all of these visions as to who you want to be, and how your husband will be there for you and when he'll be there. And if that just gets literally the rug gets pulled out from under your feet, which
you lose that control.
You don't have any control.
I often talk to clients about living a life that's true to themselves and true to their own values and true to their own strengths. They're not living a life that their parents have told them to live, or and stuff. And once they understand what those strengths and values are, they kind of go, okay, that doesn't align, but this does. And it is part of that pain journey, isn't it?
Yeah, it really is. And I think that you mentioned about the emotional content, and I think that is so important too, because like you said, we often get told to not express our emotions or even
Mhm.
acknowledge they exist. And so we bury them. But when we bury them inside ourselves, as Gabor Mate says and Bessel van der Kolk says, the body keeps score.
Yeah.
So we internalize the anger, which is really destructive. Like you mentioned, you were really angry. And when we internalize that, the anger gets internalized onto ourselves. So it starts being very self-destructive,
Yeah.
even if we're not aware of it, because that energy still exists because we haven't dissipated it in any way. And I imagine your ways of dissipating anger was probably through exercise, and that
Which I was
ability to
told not to
dissipate
do.
was taken away.
Yeah.
You know.
But I also find, I just thought of two things. So when you're a parent and you're undergoing some kind of stress,
Yeah.
you really try not let that stress show because you don't want your kids to feel it.
Yeah.
So you try and protect them from it. And I felt like I was putting on a show or an acting for a long period of time. And you know, I'm feeling really stressed and I'm feeling really pissed off with the whole situation that we're in. And when the boys go, "Where's Daddy?" I go, "Oh, it's okay. Well, he'll be home soon." And I'm constantly putting on this act. And I remember at one point they were pushing my buttons, as they all do,
Yeah.
one evening. And it was at the end of the day. I'm exhausted. And I kicked the door and I literally kicked it off its hinges. But it was just that little, like, not little, but an outrage of just pure frustration. And then they were crying, I was crying, and I was like, "Kids, don't ever, ever do that. Mummy's really sorry. I'm so sorry. Please don't do that." But that was a result, again, of this pressure cooker and me constantly putting on an act and suppressing my emotions, thinking that that's helping my children.
Yeah, and I think sometimes, you know, we do that, and I have done that historically. I don't tend to do that anymore.
I'm
But I
really
think
chilled now.
say again.
I'm really chilled now.
Well, I think sometimes it's good to express how you're feeling to your kids, because it's telling it's okay to be angry. It's okay to be frustrated.
So true.
Everything is okay. It's okay to have an emotion. It's how you release the emotion that's the most important thing. So
Yeah.
when my daughter was really young, she would get really angry. I said, "It's okay to be angry, Lily. How do you want to release it? Do you want to run? Do you want to
I
go
used
and
to get
punch
them
a
to like punch a
cushion?"
cushion or something, and yeah.
And we'll say, like, if she because kids push your buttons, don't they? All the time. "I'm getting really frustrated now with your behaviour. I'm going to have to take some time out because I'm getting really angry." So I'll leave the room and go somewhere else and just go, "Ah!"
Yeah. Yeah.
So I think sometimes when we go back to your societal comment, where society tells us we shouldn't express our emotions, and shouldn't is the clue. That's a negative. That's an automatic negative thought. Shouldn't is like berating ourselves for even having an emotion.
Yeah.
And who's to say that anger isn't a good emotion? Who tells us it's a bad one? Because we
Exactly.
can use anger in a really positive way to drive ourselves forward.
Yeah,
In life.
absolutely. And leads me to think about there was a program on BBC about naval warships, and this the captain of the ship would let these guys have shore leave when they got ashore in America or something.
Yeah.
And he says, "I know that they're all going to go and get pissed, and some of them may end up in a fight." And and the interviewer is saying, "Are you going to discipline that? And what happens?" He says, "To be honest, I just know it's going to happen because we employ people with fire in their belly." And we want that fire in their belly for when they go and fight. And that's when they are allowed it. But then because they've employed that type of person to then go and wanting to let off steam in a town, city somewhere, suddenly they're not allowed to
Yeah.
be like that. So again, that's a society thing. But this captain of the ship, I thought, was really quite, in tune, because he's like, we need people like that.
Yeah.
That's what gives them the fighting spirit.
And that's why you have your internal socials on ship as well, is allowing people to let off steam.
Yeah, exactly.
So
yeah.
They do it in a constructive rather than a destructive way.
Yeah, absolutely.
And it's finding that outlay, isn't it, to do that. So how did you find the route that helped you unchain your pain? What were the key things that you discovered would really help you? And could you just bring us back to where the pain was now centered? Because you've been into Saudi, there's a legal case going on, you are now back in the UK, trying to set up your home again with your kids and your husband, and he can sleep on a friend's couch if he's working overseas or what have you. He's stuck over there.
It was really sort of gradual, because when I left the RAF, I then decided to go and do massage and cranial sacral therapy, because that's what I felt really passionate about, and I actually always wanted to do physiotherapy anyway. So I went into that line of work, and then because I'm in that line of work, I'm constantly reading about it. I'm going on training courses. I'm learning about it. I'm helping other people overcome pain. So the more and more I read, and the more I tried it myself, the more I unchained my pain. It wasn't just a sudden thing. And so kind of where I am now, I am pain free. We're living in Shropshire. Husband's got a normal job. We've got this little sort of homestead small holding thing, so it's really peaceful, chilled. I've got a little bit more of me time because the kids are in school, and life is like normal, and I'm able to take time out for myself and do some of my own exercise and look after myself. So I don't think there was like a one point that there was a few aha moments. One with Lorimer Moseley, one was going out for a run in Saudi. The other one was trying the keto diet. And actually I was like, oh my God, I can actually touch my toes and I'm flexible. There must be something to this nutrition thing. So I went and did a 12-week nutrition course. So a year and a half ago now, I suppose, I came up with the beat pain idea, which encompasses everything I've learned to help people overcome pain in a quicker way than I did.
And can you go through your modality that you use now, what BEAT stands for?
Yeah, sure. So BEAT stands for Brain, Energy, Activity and Therapy. So the brain element is the brain health, it's the nervous system, but it's also the pain education. It's teaching clients how pain works, what are the components of pain, what amplifies pain and what turns pain down, what departments of the brain do these signals go to in order to perceive pain. So that all comes under the B. The E element in the energy is nutrition and sleep, because that's what gives us the energy to heal. We have to have a good night's sleep in order to heal, and that sleep has to be restorative sleep. If you're having sleep because you're drinking alcohol or taking drugs, painkilling drugs, whatever, then that's a sedative sleep, and it's not actually going to heal you. It might just knock you out for the hours that it's dark. So trying to coach good sleep hygiene in order to overcome pain. And then the other element of the E is the nutrition, the anti-inflammatory diet. The A, activity, is just movement. It's any kind of movement. I meet the client where they're at. If it's a case of all they can do is lie on their back and rock their knees side to side, then that's their movement. If they're already doing that and they want to be able to hike in Snowdon because that's their goal, then let's get them walking every day. Let's get them 10 minutes, 20 minutes, and increasing that level of tolerance. Or Pilates. I also do Pilates instruction as well, because again, that's what helped me. And I think the fact that I'm physical education officer from the RAF, I'm used to taking people through a bit of a program. I don't want to say exercise because that can be a negative word for some people. And then the T element, the therapy. So that's sort of the hands-on therapy that I do, the massage and cranial. But if they're not local to me, because a lot of the beat pain stuff I do is online, then once we've got a really good understanding of what is the root cause of their pain, if after doing the BEA element they need therapy, then I can signpost them to somebody who is more likely to help them, rather than a scattergun approach of what I did, which was trying everything. So that's how I incorporate the T element into the online program. But
I love that.
Often they don't even need the T element. Once they've mastered the BEA, they're in control and they know what to do. And we have this sort of flare-up management plan, etc., that they can put in place when they get a flare-up.
And do you know what I think is really great about the approach that you take is you're empowering the person first and foremost, because I think what often we start with a therapy, which takes the power away from the person, like they can't control it. And then we go back, if we're lucky enough, we might start focusing on the brain, but someone's told you it's all in your head. So you've already got like an issue about the fact that your brain actually runs everything, but apparently it's all in my head. Yes, it is, because your brain's there.
Yeah.
And
but there's a way of saying it, isn't there?
And the nutritional piece, which is fundamental to everything, but often the last thing that anybody talks about.
And I think the nutrition bit is not often included in pain management programs
at all.
Yeah, and I think that's where my sort of unique selling point is that I do include it, and it's one of the first things that we do sometimes. And it certainly wasn't included in my RAF month-long program. Nothing was talked about nutrition, and I think it's becoming more and more important because our diets are becoming poorer and poorer and poorer.
So inflammatory.
Yeah, because we're looking for convenience and we're not realizing, you know, even alcohol, going back to society side of things, alcohol is an inflammatory product. And if we drink alcohol, our body becomes inflamed. And I've done a post on my social media, which was, how often do you go out for a night partying, dancing, drinking, and you wake up the next morning and you're really stiff and aching and you think, oh God, I must have been dancing really well last night. It's got nothing to do with the dancing. It's just the fact that our body is now inflamed because of the alcohol. And over Christmas, I had 2 people say to me, oh, my back's sore today. Funny enough, on Boxing Day, a day after possibly a lot of alcohol was consumed.
No, so and I think we totally underestimate the impact that nutrition, what we eat and what we drink actually has on our whole body health. You know, everything from diabetes through to dementia, through to chronic pain, everything that, you know, if we can't get the fundamentals right, and I like to think of the analogy, if you're putting petrol in a diesel engine, it's not going to work properly.
Absolutely.
If you're putting the wrong lubrication on your car, it's not going to run smoothly. It's exactly the same in our body. We need the right fuel and we need the right lubrication in order for us to function properly. And if you haven't got those right, it's very hard for the therapy to be effective because your body is already seized.
Yeah. And that's why it's in the E bit. It's the energy. It's the energy we need. We need good energy to get better. But the empowering piece is so, I think, so important, because we are in a society where we want other people to fix us. We want the magic pill and we want to be fixed now. We've got no patience. It's like the Amazon effect, isn't it? We want it delivered tomorrow. And that's what I find hard in trying to get sort of through to potential clients is, I'm not a quick fix, but I'm a long-term fix, or a long-term tool that you've got in your back pocket for whenever you have a pain flare up in the future. You go, you know, Katie's voice will be in your head and you're like, oh, okay, I know I'm getting this. I know what to do. And how amazing is that? Rather than going, oh, I need to go to the doctor again to get another prescription.
It's never a singular issue, right? Is it either? No. So you know, a medication typically addresses one single pathway in what could be 1,000 different pathways that are causing you to have pain. You can have a biological pathway, a psychological pathway, a social pathway, and a spiritual pathway. And if the pain medication is only addressing the biological one, you've missed all of this opportunity
Yeah.
to heal yourself by focusing on all of the other pathways that are actually causing the pain.
And what with various medications, there's often some kind of side effect as well. You know, whether it's weight gain or nausea or brain fog or headaches or whatever it might be. Whereas I like to say the side effects from my treatment process is you might lose some weight, you might gain some mental clarity, you might get some joy back in your life, you might get more energy. I mean, those are pretty good side effects.
Yeah, exactly. I agree. And I think the fact is that they are empowered to do it themselves and find the right pathway for them.
Yeah.
So when you're using a modality such as yourself, where you're focusing on understanding and unraveling the root cause of the pain, you're not putting a sticky plaster over a gaping wound. You're actually empowering the person to learn how to heal that wound, rather than putting a sticky plaster over it, which is typically what pain medication does.
Yeah, exactly. And what I actually find is just having that luxury of time, which I know doctors don't have, having that luxury of time with a client, that in itself is so healing. Just listening to their story and understanding and empathizing. Just one conversation, they can walk away feeling, God, I actually feel so much better.
Yeah, I love that. And I'd love to dive now briefly into the 5 pillars of brain health, because I know we talked about what optimal brain health is for you personally, and you talked about the importance of connection early on. So if we dive into the pillar of connection, so just for anyone that's not aware of the 5 pillars, we look at our feelings, our actions, our connections, our thoughts, and our surroundings. When you think about connection to yourself, what's the most important value that guides you in life?
The important value is working out what your own strengths are and aligning your life to those strengths, and not what other people have told you that you're strong at or good at or poor at. It's working it out for yourself and going about your day being true to yourself, having that kind of self-awareness of what floats my boat and what doesn't. And if I'm doing something because I'm a people pleaser, which I kind of am or used to be, then it's not aligning to yourself. Why are you doing that? And if your answer is, oh, because so and so wants me there, then you're not. It's like bottling up your own feelings, isn't it?
Yeah. Did you notice that your values weren't being fulfilled when you went on that journey, when you were in the
Not at the time, no, not at all. And I didn't even know that was important. I was purely fixated on the fact that my spine was, can I swear?
Yeah, of course you can.
My spine was fucked and that I couldn't move. And I was age 30 and is this it now? Is this it for life? Great. So downward spiral I go. But yeah, really, I didn't even know that was a thing, trying to live life according to your own values. What I have learned now though, since, is about identity.
Yeah.
So I would always have identified as a strong, fit young lady going through school. I was in the hockey team. I was a strong swimmer. I was in the army cadets. Going through university, I was army cadets. I could whiz through the monkey bars quicker than half the guys. I could do the assault course, no problem. It was like my favorite bit, much better than sitting in the lecture theatre. I was strong and I was fit. Back pain hits me and I can't exercise and I can't move and I'm trying to pick up my child and I'm no longer this strong, fit woman. I feel like my whole identity had been stripped from me.
Yeah.
And then it's like, how am I going to go about my life now? I mean, I was physical education officer. What do I do now? I can't do that. So my pain journey is, I guess, trying to build up that identity again back to who I really am
I love that. And the fact that strength is such an important value to you is understandable how your pain journey became such a difficult one, because that your core value was stripped away from you, like you said, and you had to rediscover it and bring it back into the frame again.
Yeah.
So I love that. And just in terms of thoughts, because it's so important in the context of feelings and how that manifests in the context of pain. What stupid or crazy thought have you often told yourself in the past that isn't true?
Again, that my back was messed up. Now,
but
I think
somebody else told you it, right?
Yeah, somebody else told me that. Stupid, crazy thought that I
agree that's true, that you were telling yourself that your back is screwed.
Yeah.
Because if we believe the medical professionals, when they tell us something, we take it at face value, and then that disempowers us.
Yeah. And there were so many movements then. I can't do that because of my back.
Yeah.
Or I couldn't sit in the car for that long because of my back. And now I know that's actually, it's negative, it's destructive, and it's not true.
Yeah. Which, you think to yourself, how many thousands upon thousands of people with I've had lower back pain, have been misdiagnosed or told misinformation that has sent them on a trajectory that resulted them in having the symptoms that presents as the diagnosis they've been given, and actually they have the power to take back control and reverse the symptoms they're experiencing, but somebody has completely disempowered them through the diagnosis that's been given.
I was having a conversation just recently with a client who is he's awaiting an operation, but he doesn't know what for. It's an exploratory operation because he's got unexplained pain, and he's just gone for an MRI scan. And because we've been talking a lot about Lorimer Moseley's the danger in me's and the safety in me's, if the way we talk to ourselves can be a danger in me if it's negative, but if we flip that narrative, it can become a safety in me. And our beliefs, the belief about my back being a crumbling mess, turning into a belief that actually my back's really strong. So weighing up these dangers and safeties. And I said to him that, going for this scan, it can actually be a danger in me. You seeing pictures with a doctor pointing, oh, this is wrong, and this is wrong, can start to make you adapt the way you move, adapt what your inner belief and inner chatter is. So I just wanted him to be really aware that even if there's a diagnosis, like mine was degenerative disc disease, that's a diagnosis. But what kind of diagnosis is that? It's like saying, I've got wrinkle disease, I've got grey hairitis. It's like, it's normal. It's just because we're not looking at a really young textbook picture. So I want people even just to have that empowerment before they go in for a scan, that it doesn't paint the whole picture of pain, and it can be quite destructive.
Yeah, no, I totally agree. And having had a scan myself on my shoulder, where I've been told that I've got something wrong with my shoulder, and actually very recently my psychiatrist said, try and consume more salt because you may be low in sodium, and I've been consuming more salt, and lo and behold, my shoulders got a lot better very quickly.
Oh wow.
Yes, it is a huge wow. It's the only thing I've changed in my diet on a significant scale.
And that came from a psychiatrist?
Yeah.
Wow.
Yeah.
That's amazing.
Yeah. And so, don't believe everything that a medical professional tells you. You can listen to it, but it doesn't mean you have to absorb it and, take it on board as read. Make sure you get a second opinion. And always, if you're as you have done, thankfully, on your condition, explore what other modalities are out there and find the one that works for you, because the first one might not be the right one.
Yeah.
Because it might be targeting the wrong thing associated with pain.
Exactly. And so much is trial and error, unfortunately. And again, when it comes to nutrition, you know, if you've done all the basics, I call them basics, but cutting out sugar, cutting out alcohol, cutting out ultra processed food, increasing omega-3, leafy greens, and all of that. If you've done all that and you're still having issues, then it might be, okay, let's do an elimination diet. Let's eliminate gluten. Let's eliminate soy, dairy. And it can be trial and error. I'm a bit of a fan of Rangan Chachi's podcast, and his one at the start of this year in his Change book. It's about, he talks about empowering patients. You know, there is so much out there on the internet now that to take control of your own health rather than expecting the doctor to do it for you, and having that interoception, that listening into your body. What does my body need? Is it hunger, or am I just thirsty? And he talks about that, which I think is really useful, because we're not used to doing that, tuning into ourselves and listening to what our body needs. We expect other people to tell us.
And I think also going back to your earlier comment, we don't give ourselves time to do it.
No, we're too busy.
You know, we're too busy. And historically, you know, if we go back to the Stone Age, not even that far, we used to have lots of tribal gatherings where people would, you know, connect through dance and connect through all sorts of different mediums in order to rejuvenate themselves. And we don't give ourselves that permission to rest and rejuvenate in ways that work for us. We just expect the paradigm of medicine to come in and fix us.
Yeah. And when you talk about the spiritual element, I was raised as a Catholic and was sort of made to go to church every Sunday, and I just kind of thought, I don't really see the point. I'm not a very good serving Catholic at the moment. But I think, and again, lockdown has made me realize this. So whatever religion you are, whatever powers you believe in, and that sense of community, whether it's at a mosque or a church or whatever, is actually really good for us.
Yeah, it is.
That coming together of the community, sharing stories, singing together. I've now actually sort of realized the importance of spirituality, even if it's not through the church, but it's through other means. And one of the other examples I can think of is the Military Wives Choir. When that started, and I had a bunch of my friends that were going, and I was like, I can't sing. They're like, it doesn't matter, just come. I was like, I was so nervous. And I was like, okay. I went along, and I couldn't sing, but oh my God, I walked away feeling so much better, because I'm sharing an experience with other women who are going through something similar, and we're just letting off steam by singing. And that's in like a spiritual thing.
It's a spiritual connection to others, isn't it? So it's a higher power that is drawn from the sense of community. So that you kind of give each other this power by being together. You empower each other because you've got that relatable element that's above you, around you, if that makes sense. Absolutely. That you can all relate to. And I really connect with what you just said there, because I recently had my brain scanned at the Amen clinics, and I have a very emotionally traumatized brain, shall we say. And I thought, well, I'll go and connect with the church. And I'm a Catholic, not very good Catholic for many years.
A bit like me then.
I'll go reconnect and see if I can relate to the church again, because a friend of mine, she said that the Catholic church here is really good. And I stepped in and started singing, and I was like in floods of tears. And I thought, my God, I need to release my emotions through singing. Singing is really important. So now I go a lot more.
I haven't been to church in a while, and I went to my son's carol service just this Christmas. I just started crying. So I was like, he's year 6 and he's going to go to secondary school next year. I was like, oh my God, this is my last carol service. And I was crying. I was like, what the hell is wrong with me? I obviously needed it. As you say, I needed that release.
I mean, there's certain songs that I really struggle to sing because it brings back memories, and there's a lot of emotional not trauma,
It can
but
be
like
very triggering, can't
it
it?
can be really not in a bad way. It's like,
Yeah,
oh, I love this song, but it's
yeah.
overwhelming, and I find it really difficult to sing. And eventually, I know I'll get there. I'll be able to sing it and blast my, blast my
I think we
voice
should
up.
all sing more in the shower and dance and sing in the kitchen.
Yeah. I love it, and I've absolutely loved the conversation. It's been super fascinating. Katie, before we finish, what piece of advice would you give to anybody who's maybe a parent really struggling with chronic pain and they can't find a way through the quagmire of it all?
I would say open up your mind a bit to the fact that it might just not be purely physical pain.
Mm-hmm.
I find that's the biggest barrier. You fixate on the fact that an operation or an injection or medicine is going to fix me, and it's not. If you've had pain for longer than 12 weeks, you're into that chronic pain cycle, and you've got to rewire the nervous system. You've got to calm the nervous system, look at diet, look at movement, look at your values, look at your life, and just see what aspect could you change, but don't do it all at once. Don't overwhelm yourself. Start bit by bit.
Baby steps.
Yeah, little experiments with yourself.
I love that. And we should experiment with ourselves more in a kind way and discover what really we can tune into. So I love that piece of advice. Katie, how can people get hold of you, learn more about your program, Beat, and what you do?
Fab. I have a website which is Katie Rothwell, Katie Rothwell.co.uk, and that explains a lot about the Beat pain and explains about my hands-on stuff that I do as well here in Shropshire. But more importantly, I've got a wellness hub there, so I pop stuff up there fairly frequently. I've got recipes, I've got Pilates videos, and I've got blogs about pain. So you could start there by informing yourself, learning about pain, and trying some recipes and exercises. There's a really nice spinal mobility one that's like 15 minutes long and nice and easy to do.
I will refer that to my mother.
Oh, brilliant. Thank you. So that would be a good starting point. I'm fairly active on Instagram, and that's at beat_pain_now. And then Facebook, I'm Beat Pain Therapy, and I'm pretty active on those two. And then in LinkedIn, I'm Katie Rothwell _Broomhead, which was my maiden name.
Great. We will post all of those in the show notes. So thank you for that, Katie. It's been an absolute pleasure.
I've really enjoyed talking to you. It's so nice talking to somebody who kind of gets it and is like-minded, and yeah. But it's good because you have slightly different analogies and you kind of get me thinking about it in a slightly different way, because it's really not straightforward, is it?
No, not at all. And it's the dance that goes on that I think we need to be in tune with and understand that it's not simple.
Yeah, I think understanding the process in the brain is really, really valuable.
And all I would say is, if somebody says it's all in your head, say yes, it is, because my brain runs everything. So thank you.
Yeah, my brain happens to sit within my skull.
Katie, it's been an absolute pleasure. Remember, everyone, this show is all about brain health, unchaining your pain. You're not stuck with the brain you have, all the pain that you have. And Katie has kindly been here to show us how. Thanks so much, Katie.
You're very welcome.